Well, trust is easy to lose and harder to earn. That's what Russia's cardiologists experienced firsthand, with their patients looking over the border when it came to treatment for serious heart disease. But this may soon change, as RT's Irina Galushko discovered.
Home is where the heart is, but for many Russians, their country is not where they choose to get their medical care, especially those with heart problems. As many as 15,000 Russians a year choose to go abroad to get treatment because they say healthcare at home leaves much to be desired. For the country's leading cardiologists, it's a great concern.
We have thousands of cases which can be very successfully treated here, at home. I say with all responsibility, 90% of all treatments done abroad can be done here.
But many remain unconvinced, even though centers like Moscow's Bakulev Institute have perfected some of the most complicated procedures, which can give the old or young ticker a new life. Dr. Baziashvili believes the country's recent past is partly to blame.
After the breakup of the USSR, the state had to be created anew. And in the process, the situation with medicine was let go to the point where people have, unfortunately, lost the trust in Russian healthcare.
Not so for two-time heart bypass survivor Vitaly Milayev. The former diplomat underwent extensive treatment both abroad and at the Bakulev Center.
Our healthcare is far stronger and kinder than Western, especially now when many medical centers have the technology we're used to seeing in the West. But most importantly, our doctors have soul.
That, along with well-trained hands, is something which allows Russian doctors to save lives daily, with operations unheard of just a few years ago, such as replacing a human heart valve with one from a calf.
I'm holding a frameless prosthesis of an aortic valve from the cardiac sac of a calf. We purchase hearts from meat packers, bring them here, isolate the necessary tissues, give them the necessary treatment. The treatment methods are protected by our patents. And then we sew a valve from this tissue that can fully replace a damaged human valve.
Thousands of such procedures have already been performed at the center on patients as young as just a few weeks old, to those whose lives are in full bloom, like 24-year-old Natalia, who suffered from a hereditary heart condition.
The feeling right now is that I understand and feel like a completely healthy person.
A priceless feeling of inner health achieved without heading outside Russia's borders. In Moscow, Irina Galushko, RT.